everyone. Thanks for joining me this morning. So today we're going to be doing some power yoga, and we're going to finish with some meditation and mindfulness. So why are we choosing power yoga and meditation today? So for the purpose of today's activity, yoga will be referred to as our chaos. The goal is to move you through a fast-paced routine that will ultimately get your heart rate up, your body warm, and allow for the physical release of tension in the body. This is meant to mimic the quick pace we often engage in our day-to-day lives. And this can become problematic during the times that we forget to check in with ourselves. We end up carrying around a lot of stress that can overall impact our health and wellness. The stress hormone in our bodies is called cortisol, and when there is too much cortisol lingering around, we see an increase in the likelihood of developing heart disease, cancer, stroke, among many other chronic conditions. And oftentimes, chronic conditions begin to affect the way that we engage in occupation. And when engagement in meaningful occupation is lost, our quality of life is set to decrease. So practicing yoga and meditation as a complementary approach to treating one's chronic health conditions can allow for the decrease in cortisol and pain while increasing greater sense of self of well-being, feelings of relaxation, and attentiveness. And while all of these positive factors come into play, it also allows for the individual to regain the motivation needed to engage in meaningful occupation, thus overall improving the quality of life. Now that is the yoga side of things, and we're going to be ending today with meditation, and this is to represent the calm that we need in our lives that we often forget to bring in. So the meditation is going to be used to downregulate our heightened state of arousal, to recenter the mind, body, and spirit, and to ground ourselves in our practice. So yoga and meditation are known as complementary health approaches, and these mean that using yoga and complementary health approaches can be used in conjunction with more traditional treatments and therapies to alleviate symptoms and reduce pain. It may also be used to enhance quality of life and personal well-being. And examples of complementary health approaches include yoga, meditation, acupuncture, mindfulness, and Tai Chi. So linking all of this to the OT scope of practice, OTs use complementary health approaches in integrative health, also known as CHAIH. OTs can use these approaches to complement their intervention plans. They're required to provide ethical treatment within their scope of practice, and to integrate complementary health approaches into practice, they must obtain specific CHAIH knowledge and training to ensure that their complementary approach is safe and effective. As for considerations, it's important to consider methods to support the client's goals and to facilitate their participation in occupation. So we really want to make sure that this approach falls within the client's performance skills, client factors, performance patterns, and values and beliefs. And the best way to incorporate complementary approaches is through collaborating with the client to ensure that the approach is something that they're interested in and something that they find to be very motivating. Research does support the efficacy of using complementary approaches within the OT scope of practice. Evidence shows that yoga has been linked to decrease anxiety and shows increase in self-confidence and communication with children with behavioral difficulties. And evidence also shows that yoga combined with Tai Chi can be used to improve upper extremity functioning, balance, and mobility and participation in those with motor impairments. So using these complementary health approaches in integrative health, these can be used in 3 different ways for OTs. It could be seen as a preparatory task through deep breathing, guided imagery, and yoga. It can also be used as an occupation, such as engaging in mindfulness and meditation, and also an activity, such as standing yoga poses and Tai Chi. So for the purpose of today, I'm going to be introducing 7 new poses. We're going to be doing halfway lift, forward fold, chaturanga, up dog, down dog, warrior 2, and we'll be finishing with the Shavasana pose, and this is where we're going to have our guided meditation. So everything in this PowerPoint is going to be linked on the discussion board, so you can always refer to this if you like today's flow, and you want to refer back to these poses and begin to incorporate it into your day-to-day routines. So my recommendations for adoption for yoga, I would say aim twice weekly for about 30 minutes. And you can progress to 3 to 4 times weekly for about 30 to 60-minute sessions. Zoom classes are available. Zoom Yoga now hosts group classes for $5 per session or $39 for the month. Dragonfly hosts yoga classes and guided meditation daily. These classes vary in cost, and that's also linked down below. You can also utilize free classes via YouTube. My favorite channel to visit is Yoga with Adriene. She's very energetic, upbeat. She really knows her stuff, and she has classes for all different levels of experience, and they range for short pops, or you can take like a 60-minute class. And her information is linked down below as well. And then for guided mindfulness and meditation, I would say practice making mindfulness and meditation a habit. So you want to do this by beginning practice 5 days a week for about 10-minute sessions. And then you want to progress to daily sessions for up to a half an hour. You can download the Headspace and Waking Up apps. These are available through the Apple Store and I want to say Google Play. And to learn more about the science behind why Headspace works, that's linked down below. And to learn more about why Waking Up works, also linked down below. Both of those apps, I think, have a premium cost, but I'm sure there are other mindfulness and meditation sites out there that would be of lower cost. I want to say Headspace is the lesser of the two cost-wise, and that's the one that I like to use. Here are my references for today, and I will see you on our mats. Hey everyone, so I'm going to be introducing the poses that we're going to be using today. We did see some of them on the PowerPoint previously, and I'm just going to show you what they look like in motion. So our first is our halfway lift. So standing upright, we're going to come, have our flat back, tension in the hamstrings, soft bend in the knees. Hands come to our shins. Keep your head neutral. This is our halfway lift. And halfway lift moves into forward fold. So bringing all of that weight just straight down, letting gravity take you. This is our forward fold. So we had our halfway lift, the flat back, forward fold. So chaturanga is our next pose, and this is essentially like a plank position. So you want to be here, head up. You're going to keep your hips up, glutes are tight, your abs are tight, and pressing down, bending the elbows, we move into our up dog. So the hips drop slightly. We begin to look up towards the sky. This is our up dog. Now we're going to shift our weight backwards and push it into down dog. So all of our weight is coming through our hands and down into our feet, pressing it into our heels and through our calves. And this is going to be our down dog position. And then from there, we're going to move into warrior two. So I'm going to bring my left foot forward between my hands. I'm going to press myself up, warrior two, rise up. My back foot spins. And then I sink into the position. So I have a slight bend in my back knee, big bend in my front knee, and my arms are extending in both left and right directions. And this is our warrior two pose. And then today's session is going to end with Shavasana. And so now that you know all of these poses, I'm going to show you what they all look like put together. And this is going to be a cycle that you can use and repeat for as many times as you feel fit. Usually about 5 or 6 times before the heart is elevated and the body is warm and you're breaking a sweat. And that is going to be referred to as our chaos. So our first pose is halfway lift, so we're going to have a flat back, soft bend in the knees, and look up. So this is our halfway lift. And fold, releasing the tension in the hamstrings. Moving forward into chaturanga, so this is a plank position. You want your glutes and your abs to be tight and pulled up. And then sinking into up dog, we drop our hips, lift our chest to the sky. Pushing back into down dog, all of our weight shifts backwards. And we feel that tension in our calves as we push our heels down towards the ground. Following that, we're going to be sending our right leg up to the sky, keeping our weight pushed down through our heels and our calves of the opposite leg. And this is going to open up our hips. Now we're going to bring our right leg forward through our hands, gently, as we move into warrior two. Now here we are in warrior two. Bringing our hands back down. Bringing our right foot back, pushing our weight down into down dog. We're going to step or jump forward. Now we're going to move back into halfway lift. So flat back, look up, and fold. Halfway lift. Chaturanga, so our plank position. Abs and glutes tight. Drop the weight in our hips. Look up towards the sky and up dog. Pushing our weight back into down dog. Feel your weight sink into your heels. Now we're going to do the same thing with our left. So send your left leg up to the sky, pushing the rest of your weight down into your right leg and open up your left hip. Bringing your left foot forward. Warrior 2, rise up. Spin the back foot. Sinking our weight forward. Now bringing our hands back down. Sending our left leg back into down dog. Pushing our weight down through our heels, step or jump forward. And so today's session is going to end with the Shavasana pose, and this is where I will be leading you through the guided meditation. So this pose is essentially just laying down flat on your back, and you're going to let all of the tension in your body go, and you're going to feel yourself kind of melt into the ground. So what I like to do is lay flat. I like my palms up. I let my feet come out to the side. I let go of all that tension. Sometimes my head nods off sideways, and that is perfectly fine. So again, this is the pose that you're going to take, and I'll see you in the guided meditation. Now that you're laying in the Shavasana pose, I want you to begin by bringing your attention into your body. You can close your eyes if that feels comfortable to you. And I want you to notice the feeling of your body positioned against the ground. Take a few deep breaths in and out. And as you take a deep breath, bring more and more oxygen, enlivening the body. So breathe in. And as you exhale, have a sense of relaxing more deeply. You can notice your feet on the floor. Notice the sensations of your feet touching the floor, the weight, the pressure, the vibration, the heat. You can notice your legs against the mat, feeling the pressure of your body against the floor, pulsing, heaviness, lightness. Breathe in and let it out. Notice your back against the floor. How does it feel? Is it stiff? Do you feel tension? Now bring your attention to your stomach area. If your stomach is tense or tight, let it soften and take a breath. Notice your hands. Are your hands tense? Are they tight? See if you can allow them to soften and melt into the floor. Now notice your arms. Do you feel any sensation in your arms? Let your shoulders be soft and let them sink into the floor. Breathe in. Breathe out. Notice your neck and your throat. Let them be soft. Relax. Notice your jaw. Is it tight? Soften your jaw. Let your face and facial muscles be soft. Now notice your body and its present tense. Take one more breath. Feel your chest rise and fall. Breathe out. Be aware of all the sensations that your body is telling you. Take a deep breath. And when you are ready, you may open your eyes.